Number 3, cross-friction strokes for instrument-assisted soft tissue mobilization. Cross-friction was the basis of instrument-assisted techniques taught by some of the major seminar companies over the last 20 years. The rationale involves improving the structure of connected tissue by inducing remodeling and microtrauma. Lately, some of these theories have come under scrutiny. However, there's been a lot of new research by Helene Langevin that shows a whole new world of possibilities involved in the healing that's happening when we do these kind of strokes. So cross-friction rationale is still very much alive, even though the original theories of cyriax might be questioned or under scrutiny in the last 15 years. We are going to show this with the Myo-Bar Healing Edge 3S, and we're going to look at the iliolumbar and sacroiliac ligaments. So the main idea is to go across the area of restriction. It doesn't have to be, the fibers are going to go in every different way depending on which level you're treating. So as we mentioned in the diagnostic stroke, you're going to find out which direction gives you the most tissue restriction. And so if I find that here, now I'm going to do my cross-friction stroke. And the traditional way to do this, you're going to do it for 30 seconds, 30 to 40 seconds, take a break, and repeat it 3 times. Very, very common areas to have problems with chronic low back pain. And this is, again, one where massage techniques are excellent, all right? But I'm not going to maybe spend so much time on this one little piece of fibrous tissue that could be preventing the force transmission throughout these kinetic chains. So that's why instrument-assisted techniques are so good. When you find that little spot to bring out your tool and spend 3 to 5 minutes on it, that's all you need. So traditional cyriax is done without emollient, and you actually want to hold on to the tissue, move the tissue back and forth. That way the skin is pulling on the fibers underneath. And we may be, a lot of things are happening here. We may be doing some microtrauma, inducing connective tissue healing, but we're also loosening the superficial fascia and maybe warming the extracellular matrix. I'm used to kind of switching between strokes, so I apologize for that, but the traditional cyriax is going to be holding on to the skin back and forth. Part of this stroke, we have a modified cyriax, and that's when we can let that tool slide. Sometimes it feels right to let that tool slide in the contact. And we'll call it a modified cyriax. The last style related to cyriax strokes is the combined movement. So we'll switch over now to the iliolumbar area. A combined movement stroke is you're going to go back and forth, but you're going to follow a line. And here you can treat a wide range of the supporting tissue in a very short amount of time. And you can follow lines of pull or lines of restriction that you found earlier, going back and forth, moving along the vector.